And welcome back to Ask the Doctor. I'm your host, Mike Berger. Here to answer your medical questions on pain management today are doctors Robert Bolger and Renaud Rodrigue from the Southwest Pain Group. You can just call the number that you see on your screen. That's 1-888-572-4411. Or you can visit the website at www.southwestpainmanagement.com/askthedoctor. All right, let's get started with a question. What are the advantages of Southwest Pain Group's in-office treatments versus going to a hospital for treatment?
Well, there's many ways you can receive pain treatment. The diagnostic and technical procedures we do, but there's some advantages for coming to our office because we can actually lower the cost. We can perform the procedures more economically, a lower copay to the patient. And we have the same facilities in our office as they're in hospitals.
Right. Well, I would imagine, you mentioned copay, and that's very important to people these days, that you do take most insurances, I would assume.
Yes.
Okay. Now, Stacy's with us from Dallas, and she's on the line. Stacy, what's your question today?
I've had chronic pain for over 5 years now, and I'm only 20. I've had so many people tell me that the pain is all in my head that I'm beginning to wonder, could it be me just imagining it?
I think that's such a great question because we've all known someone who said, people tell me it's just in my mind.
I wouldn't mind taking that one on because that's a kind of a topic near and dear to my heart. I have a lot of patients that are very young, and invariably, just like Stacy, they will come to us and say, no one believes me. And you look at young people, you think they can't have pain. People kind of discount pain in the younger population. Well, how can you be in chronic pain? She started at age 15, and in all likelihood has real pain. The problem is we're told we can't see it, we can't measure it, your studies look normal, you don't have it. When again, you got to get back to the point that pain is virtually unmeasurable. Now the things you can see with studies, a broken arm, a broken rib, you can see that, a torn muscle, you can measure that, you can MRI that. Some people have pain that's unmeasurable. Headache pain is an example of that. How do you measure a headache? People tell you they have a headache. So you can't, first of all, you got to believe the patient. You got to take them seriously. You got to give them a chance to tell you their story. And really, Mike, in my experience now 16 years doing this, I find it extremely unusual that patients are making it up or that's in their head.
What I find interesting is when people talk about pain, sometimes it's very hard to relate to a doctor what I'm feeling. How do you guys deal with that?
Well, let me say that to you if you don't mind,
Sure.
Bob, because I want to tell you that's, and I'm hogging the show a little bit here, but I'll tell you, pain's hard to measure and it's hard to describe too.
Yeah.
That's the real conundrum. It's how do you describe to your doctor the pain, and you'll find that patients use different words to describe their pain entity, and we use that. It's helpful, but a lot of it's too just the progression, how it's changed over time, how its onset. We can work with people and figure that out.
Very good. Another caller, Tammy is with us. Tammy's from Frisco. What do you have for the doctors today, Tammy?
I hurt my neck about a year ago, and I've been on pain pills ever since, and I'm afraid of becoming addicted to them. Should I just stop using them right now?
Well, I think an important thing for Tammy is that she does need a diagnosis. And so having a diagnosis is critical because once you have a diagnosis, there are ways to impact that pain, treat it, perhaps come up with a solution that won't involve medications. So the answer is yes, we can help people wean off their medications, and we do that as an outpatient all the time.
And there are people who actually do need to be on pain medications chronically. And there's nothing wrong with that as long as you're monitored by someone who understands the drugs, their side effects, the problems of tolerance, etc. So she doesn't necessarily have to come off her drugs. It just depends on what's going on.
Well, a question I have and it happens so often now, especially with insurances, that I'll go to my physician, primary physician. He'll tell me, I'll say, Doc, I have this pain, so on and so forth. He'll give me something for it. I'll go home, and that's the end of the story. But the pain doesn't go away. Now, can I ask him to refer me to you, or can I just call you?
We take referrals two ways, and originally, pain management doctors were typically referred by other specialists. We actually see patients directly, and that is an important thing for people to understand, that we actually can coordinate their pain care. We will try to find the cause and try to manage that element of their care.
Very good. Keith from Garland. Keith wants to know if his pain management will be covered by insurance, and we've been talking about that a little bit.
Typically it is. Most of the time, most insurance companies will cover pain treatments. There are some unusual or I would say avant-garde or cutting-edge treatments where there can be some difficulty at times getting them covered, but we will often go to bat for the patient. We will try to contact the insurance company, and we will make a compelling case for the treatment if we feel it's ethical.
Definitely. It's rare that patients can't come to us and seek treatment, even chronically, because of payment issues. That's rarely the case.
I'm kind of curious to know if there's a, how should I put this, a wow factor in pain management, something maybe people don't know or don't understand.
Well, I think that for me, one of the biggest things for people to know about pain management is that you have to make sure you pick the right person. There's a wide variety of doctors treating pain, and so not all pain management doctors are the same.
Is there a way to judge that then? If obviously I like you fellas, so I would call you, but what about anyone else that's just watching the show today?
If I were to recommend one thing to patients, I would say do your homework. You want your doctor to be fellowship trained. A fellowship is a specialized training. It's an elite training it's only awarded to a certain group of doctors. So if your doctor's fellowship trained, anesthesiologist, obviously, because anesthesiologists are the most skilled doctors at nerve blocks. That's what we do every day. So if you've got a fellowship trained doctor in anesthesiology, you're probably board certified. You have a pretty good chance you're going to get a good doctor.
Get somebody who knows what they're doing.
Right.
And that's always important. Scott in Mesquite would like to ask if there's a difference between acute and chronic pain. And we touched on this a little bit, but again, what would the biggest difference be?
I think Dr. Rodriguez spoke to this earlier. I think that the strict definition of chronic pain is pain you've had for more than 6 months. But from our perspective, it really ends up being patients that come to us who other people feel like they can't help. They'll tell us every day you hear this, well, my surgeon said I'm better, my back healed, or my fracture healed, or they don't know what's wrong with me, but I'm still hurt, and they don't know what to do. That's really ends up being what we view chronic pain as. I can't be helped anymore, what can you do for me? And that ends up being, you agree?
Absolutely.
And what kind of success can people have? Because everybody's different, different problems. If I had a chronic pain, can I expect or hope to expect 50% improvement, 75% improvement? Is there a particular?
That'd be hard to answer.
Yeah.
because it would really depend on the disease and what the problem is. For example, with headaches, we can make real big inroads in headaches. There's exciting new therapies in headache. But if you've had a chronic pain for 15 years in your back or your foot, we might have a hard time giving you an exact percentage.
But we could definitely make an impact. It's rare that we
help
can help
everybody,
people.
Mike, to some
and
degree.
then it's just a matter of degree.
Right.
But we really do look at it as a disease by itself. It's like having diabetes. It doesn't really go away a lot of the time. So we manage it like a disease over the long haul.
And that's very important to remember, that it is a management.
Right.
We're going to take a short break. Again, if you would like to call us with your questions, the number is 1-888-572-4411, or you can go to the website. That's www.southwestpaingroup.com/askthedoctor. We'll be right back.